name is Caitlin Dale and this is video 25, Positioning and Collimation. Today this is my patient Mia. She is a 7-year-old desexed female Japanese Spitz weighing 9 kilos. So I'm going to safely use a slip lead to transport her to the x-ray room. Go straight over her head and take her to the x-ray room.
Hey.
Hi, Caitlin Dale, resuming video 25. Now that my patient is safely up onto the table, I'm going to roll her into dorsal recumbency. So turning her over onto her back safely and comfortably. And then I'm going to be using my sandbags here just to help keep her in place while I'm taking the x-rays today. So one sandbag each down the side of her body, supporting her legs here. I'm then going to take these these ties here and pop them onto her forelimbs here and pull them forward cranially and lock them into place. I'm going to center the beam over the caudal aspect of the scapula here, and this is also where I'm going to take my measurement of 10 centimeters. I'm then going to ensure my collimation includes all of those ribs here. I'm then going to take my directional markers and place that onto the correct side of the body, so the left marker on the left side of the body, but also ensuring that it's within the collimated area but not obscuring any body parts here. So now that I have her in this position, I'm going to help keep her straight by using the primary vertical line on the primary beam to make sure she is nice and straight here. And when the image is taken, I'll know that she's in the correct position because the sternum will be superimposed over the spine. So now that she's all ready to go and I've collimated, I'm going to use the technique chart here to look up the KVP and MAs to use for a VD thorax. So we have, for 10 centimeters, we have a 54 KVP. 54, so I'm going to change the thickness to 10. And I'm going to up my KVs to 54. And I'm going to change my MAs to 5. Once this is all set up, I can then take my exposure. Hi, Caitlin Dale, resuming video 25. So next I'm going to position my patient for a lateral stifle. So I'm going to turn my patient into lateral recumbency safely and comfortably. I'm going to ensure that the leg to be radiographed, so today the right leg, is down nearest to the cassette. The other leg, so the left leg, does need to be abducted and tied out of the way so that it's out of the view of the x-ray and just secured out of the way with the rope or tie. I can also use a small foam pad to place under the tarsus of the x-rayed leg just to ensure that tibia is parallel to the table. So I'm going to collimate my beam over the stifle, and I'm going to take my measurement over the femoral condyles, which is 7 centimeters. I'm going to ensure that I collimate to include half of the femur and down to half of the tibia. Even if you are doing these x-rays for TPLO, you do need to ensure you extend that out to the hock just so that the vet can get their measurements correctly. So now that we have got this patient all positioned, I'm going to pop my directional markers to the cranial aspect of the limbium radiograph. So the right marker is going to go over the cranial aspect of this limb here. Now I can use my technique chart for extremities, so to work out my KVP and my MAs. So 7 centimeters is KVP 48, so I'm just going to change my thickness to 7, my KVs to 48, and my MAs are going to be 5 again. I'll know that my patient is in the correct position when the x-ray has been taken, because those femoral condyles will be superimposed over each other. Caitlin Dale, resuming video 25. So now I'm on to my third position. So we are going to do ventral dorsal abdomen. So I'm going to turn my patient back into dorsal again, nicely and comfortably and safely. Again, I'm going to use, you can either use a cradle, or I'm going to use sandbags again today to help support that thorax area to keep her nice and straight. You can leave those back legs to flex into a normal position, so frog leg position here. With larger dogs, you can also use a rope and tie to keep those legs nice and cranial for additional support. But with smaller dogs like Mia today, they usually stay in this neutral position pretty nicely and comfortably here. So we are going to center that beam over the caudal aspect of the 13th rib, and we're going to collimate to ensure the diaphragm is included down to the top of the femoral heads. We are going to take our measurement at that caudal aspect of the 13th rib, which is around 10 centimeters today, and we are going to place our directional markers into the collimated area, ensuring it is on the right side but not obscuring any body parts. So right tag onto the right side today. We will know the image has been taken correctly, as the image will show the 13th rib down to the top of the femoral heads. So now that the patient is all ready to go here, I'm going to grab my technique chart again and use the canine abdomen for 10 centimeters. So 10 centimeters should be KVP of 50. So we'll change our thickness down to 10, and we will pop on our KVP to 50, and our MAs will be 10. So once that is all set up on here, again, we're all ready to take that x-ray. Caitlin Dale, resuming video 25. So as you can see through all of those three views, I have been wearing my PPE. So I have my lead thyroid protector, I have my lead gown here, and I have also had my TLD here, which has been monitoring my radiation exposure. We do also have lead gloves in clinic, and eyewear to wear as well if needed. Obviously, wherever possible, we do stand outside the room to take the x-rays, but if we do need to be in the room to manually restrain, we stand as far away from that primary beam as possible. We do also have a warning light actually outside our x-ray room, and anytime that we do take x-rays, we do always loudly say x-ray before taking the exposure. In line with legislation, Cert 4 vet nurses can take x-rays under a supervision license, and before taking any of our x-rays, we do always communicate with the vet what views that they do need, and afterwards, after we've taken the x-rays, we do then again communicate and just double check and make sure that they're happy with all of the views that we've taken, and to make sure they're of diagnostic quality. So before we do any reversing or waking up of the patients, all of the images produced by the digital system are saved automatically onto the database, and they do also go through to Vet Connect under a DICOM format for sharing abilities. Caitlin Dale, resuming video 25. So after we have used our x-ray room, we do need to clean it and obviously make sure everything has been put away nice and neat and tidy. So the x-ray table does get wiped down with F10 at a dilution rate of 1 to 500 for a contact time of 2 minutes. Obviously, if there was any gross contamination, we will obviously remove that first with water and soap. remove that debris, and then spray our F10 for that contact time. Our X-ray machine does need to be turned off, and the button just need to go up here so it's not hanging and out of the way. We make sure our directional markers are always left inside the room, just hanging at the front of the X-ray machine here. Any monitoring equipment, so we have our anaesthetic machine just over here, so we do need to make sure that there is enough oxygen for the following day. If not, replace that oxygen, make sure that ISO has been refilled every single day after it has been used, and make sure the charcoal and the soda lime canisters are not overweight or not the different colour. Otherwise, if they are, they do need to both be changed as well. So now that this has been soaking for 2 minutes, I can now wipe down this X-ray table so it's all ready for the next day or the next patient. All of those sandbags, cradles, and the ropes and ties do also need to be cleaned as well. So if there's any gross contamination on any of them, removed with soap and water first, and then sprayed again with F10 to make sure that they are nice and clean. Caitlin Dale resuming video 25. So now our x-rays are all finished, I'm going to take Mia back to her cage safely, pop that slip lead back on, pop her onto the floor, walk her back to her cage. Pop her back in, remove the slip lead, and ensure both doors of the cage are appropriately locked. Thank you. Caitlin Dale resuming video 25. So this is the waste bin here, which I have popped the hair and the paper towel that I wiped the F10 off of the treatment table.